I'm Jenna. I'm going to be your student nurse. Do you mind first telling me your first and last name and date of birth?
Katrina Friedman, 1197.
Okay, perfect. Is it okay if I call you Katrina?
Yeah.
Perfect. Okay, so I'm going to be doing a head-to-toe assessment on you today. First, I'm going to start off by asking you a couple questions. Do you currently know where you are?
Northeastern University.
Okay, good. And what is today's date?
January 31st.
Perfect. And who's the president?
Trump.
Good. Okay. So your color looks good. You look well rested, which is also good. You don't look like you're fairly well rested. You don't look like you're in any pain or anything, right? No pain?
Nope.
Perfect. All right. I'm going to start by assessing your head, just to make sure there aren't any like bumps or sores or anything, abnormalities, and I don't feel any, which is good. Your hair is clean, and it doesn't look brittle or anything. You have piercings on both ears, but they don't look infected, they look good. Okay. So now I'm gonna assess your mouth. Give me a nod. Perfect. Okay, so there's no sores or anything. Your lips look pink. Your tonsils, you're not having any issues right now. Okay. Gums and teeth look healthy, which are also good. Now I'm going to assess your eyes. So with this test, you're going to look at the tip of my pen and just follow it with your eyes, but don't move your head. I'm going to assess your cardinal fields of gaze. Perfect. Okay. So now I'm going to assess your pupils. I'm going to shine this light in your eye. Just look straight forward at me while I do it. Good. So that was me assessing Perla, which your pupils are equal, round, reactive to light, and accommodate back to normal size after, which is all normal and good. Okay, so now I'm going to assess your upper extremities. Give me a quick shoulder shrug. Good, that feels normal. I'm going to go down your arms and test for any, or check for any swelling, abnormalities, any edema or anything. Let me know if anything feels tender. No? Okay. I'm going to assess your radial pulses. Perfect. They're strong and equal bilaterally. I'm going to assess your fingers now for capillary refill. And you have nail polish on, so I'm just going to check on this side. Good. Capillary refill is brisk and less than 3 seconds, which is normal. No signs of clubbing or anything, which is also good. Give my fingers a quick squeeze. Good. Strength is equal bilaterally on both sides, which is also normal. So now I'm going to assess kind of like your lung sounds. So every time I move my stethoscope, give me a deep breath, okay? Good. That was anterior. I'm going to do laterally now. Good. Okay, so if you just want to face this side for me, please. I'm going to do the posterior side. Okay, first give me a big deep breath. Okay, so chest rise and fall is equal on both sides. So your expiration looks good. I'm going to listen now to your posterior lung sounds. Same thing, every time I move my stethoscope, give me a big deep breath. Okay, good. So your bronchial sounds up here sound good. Your expiration is louder than your inspiration, which is normal. Your bronchovesicular sounds also sound normal, where your inspiration and your expiration sounds equal in loudness. And your vesicular sounds also sound normal in loudness, where your inspiration is louder than your expiration. So that's also all normal. You can swing back around for me. Okay. I'm gonna palpate your chest now for any like abnormal contours, pulsations, that kind of thing. Okay, apical pulse. Good. And I'm gonna palpate your carotid arteries. Good. Everything feels normal. Your carotid arteries are strong. Okay, so now I'm gonna listen to your heart sounds. Okay. You got your aorta, which is your second intercostal space, right sternal border, where S2 is louder than S1. Pulmonic, second intercostal space, left sternal border, where S2 is greater than S1. We have Erb's point, which is your left sternal border, third intercostal space, where S1 and S2 are equal. We have your tricuspid valve, which is the fourth intercostal space, left sternal border, where S1 is louder than S2. And your mitral valve, which is the fifth intercostal space, left sternal border, where S1 is louder than S2. And everything sounds normal, which is good. Okay, so now I'm gonna have you lay down. I'm just gonna, actually before we do that, I wanna check your carotid arteries for any bruits. And no sound is a good thing, so I'm gonna use my belt to do that. Perfect. I didn't hear any bruise, which is a good thing. Okay. So now I'm gonna do some abdominal assessments on you. If you just wanna lay down for me. Perfect. Are you going to the bathroom? Okay. When was your last bowel movement?
This morning?
Okay. And no trouble like urinating, passing gas, okay?
Yeah.
Okay, perfect. I'm gonna listen to your bowel sounds starting at the right lower quadrant and then moving clockwise.
Okay.
Okay, good. So bowel sounds were present in all four quadrants, which is a good thing. Now I'm gonna listen with my bell to your arteries in your abdominal area. Okay. So we have your renal arteries, your iliac, and your femoral. Okay, good. And I didn't hear any bruise or anything, so that's a good thing. So now I'm gonna have you sit up and I'm gonna do your lower extremity assessment. I'm gonna look for any swelling, abnormalities like abnormal temperature or anything. No wounds or sores or anything? No?
Nope.
Let me know if you feel any tenderness.
Nope.
Everything feels good. I'm gonna assess your pedal pulse. Is it okay if I take off your socks?
Yeah.
Okay. So we have your dorsalis piece, which are strong and equal bilaterally. Posterior, good. Strong and equal bilaterally. I'm gonna check for capillary refill on your toes now. Good. And brisk capillary refill, and your toenails look intact and everything. Your heels are not cracked. There are no sores or anything, which is also good. Okay, so now I'm gonna check your patellar reflexes.
Okay.
So I'm just gonna hit this on the tendon. Good. Try that one more time. Good. Okay. So last thing I'm gonna have you do is I'm gonna assess your gait. If you could give me a walk like from here to the door and then back. Good. And back to me. Good. Perfect. Okay. So everything looks good. So
Okay.
you're okay to see the doctor now.
All right, great.
It was nice meeting you.
You too.